You're listening to Risk and Resolve, where leadership, business, and risk management collide. We bring you real conversations, sharp insights, and strategies for success. And now for your hosts, Ben Connor and Todd Hufford.
Welcome back to another episode of Risk and Resolve. I'm your host, Ben Connor, and today we have Jory Zunich, SVP of Growth from Nice Healthcare. And today is the first of its kind special episode. It's a solution spotlight to talk about Nice Healthcare. So we'll probably have to have Jory back on to talk about his personal story on another episode. But we're here today to talk about Nice Healthcare. And Jory, thanks for joining me today.
Thanks, Ben. It's great to be here.
Yeah. So just for this solution spotlight, let's just dive in. Tell us what Nice Healthcare is and why it exists today.
Sure. Yeah. Nice Healthcare is a primary care clinic, and we specialize in virtual and in-home care. And so, the very obvious strategy that we've put together is that we've taken real estate out of our business model, right? We actually don't have any physical clinic locations. We practice virtual care. And if people need to be seen in person, we come to them in their home, at their place of work, anywhere within our service territory now across 15 states. It is a unique business model. Our CEO and co-founder was dealing with a sick child in Minnesota in the middle of winter. And it was one of those scenarios where, they didn't know exactly what was going on with his son. High fever, but not a lot else going on, which led him to hauling his kiddo into the clinic in the middle of winter to be told, hey, there's not much we can do here. You should go back home. Come back if the fever gets worse. Well, the fever gets worse. He's back in there. They say, hey, it's the same situation still, and they're sent back home, all to have him get really, really sick and have a bit of an emergent situation, right? All of that followed with about a $700 bill. And he recalled being in that kind of exam room in an empty clinic, waiting with his wife and his son who didn't feel well. And so Thompson just started walking around. He said, what's going on around here, right? His parents have a home healthcare business, and he's walking into all these empty exam rooms. They all have a computer. They've got one piece of software on it, nothing else. All the drawers are empty. There's an x-ray machine sitting there that isn't being utilized, so he starts looking online. How much does an x-ray machine cost, right? Could I buy one of these? And that put him down this path of saying, I think we can do this differently. And he and his co-founders started a Nice Healthcare. And it's quickly expanded to ultimately helping thousands of employers and getting really close to about 200,000 members, right? So it's a model that kind of flipped it on its head, in a way that allowed care to be affordable and accessible for a lot of patients in a way that they are not accustomed to in healthcare by any means.
That's awesome. So a little bit of backstory of why we're doing this solution spotlight. I actually came into learning about Nice Healthcare from our experience of having several clients in the Minnesota market. And we were having conversations with employers, and they're like, hey, we really love what you're saying about supply chain and managing the health insurance delivery model. However, we have this solution called Nice Healthcare, and don't mess with it because our employees love it, which allowed us to say, well, what is that? And learn about it. And ultimately started us on a journey where about a year ago, Jory, we started talking about bringing Nice Healthcare as a solution to Indiana. Just solve the problem that your founder found himself taking care of. I see that even in our own household of when we have a sick child or otherwise, trying to solve for that. And it's painful. It's not fun. It's, you're going to a doctor's office where all the other sick people are. There's just a lot of just brokenness of the system, and you see someone for 10 minutes. But anyway, so we are so pleased to bring Nice Healthcare to the Indianapolis market starting January 1st, 2026. I'm actually wearing, if you're watching this, wearing my shirt. That's a little bit of a shout out to IU, but it has a bunch of little Indianas on it to celebrate this launch of Nice Healthcare Indiana. So as people are listening to this and they're like, oh, that sounds interesting. Jory, talk to us about more of the detail of the actual deliverable. So you mentioned that it's a clinic without the brick and mortar, and we're actually going to people's homes. And there's also care delivered even in the workplace of an employer. But what type of care is delivered? What is the experience in services that an employee has access to through Nice Healthcare?
Yeah. And that's a differentiator of our model as well. For a lot of people listening, I'm assuming we're going to be having like a fair amount of benefits advisors listening, employers in the community in Indiana. Our clinic offering is sold through our preferred broker partners to employers who are offering health benefits to their employees. Okay. So that's the only way that you gain access to a clinic at Nice Healthcare. We're not in the direct to consumer space. And what's really, really interesting about that is that the services I'm about to talk about actually represent about 70% of everyday healthcare for a typical patient. And what that means is that they're gaining access to our clinical team for unlimited virtual and in-home primary care, right? So we can see people virtually border to border in the state of Indiana. If people live within our service territory, if they need to be seen in person, we're going to come directly to them, whether that be at their home, at their place of work, at a family member's house, anywhere in that service territory. Our company also has a virtual physical therapy practice as well as a virtual mental health care practice. Something that's really, really cool about our model that hardly anyone is doing is that we own all of these practices and all of these portions of our clinical team across primary care, physical therapy, and mental health care. These are full-time W-2 benefit eligible employees of Nice Healthcare. We're not farming people out to 1099 or part-time workers who are picking up a few hours here and there. This is all controlled in the Nice Healthcare ecosystem. We have built all of our apps and our technology. So patients who are seeing us in Indiana are getting the exact same care as patients who are seeing us in Washington, Minnesota, Colorado, Arizona, things along those lines, right? That's a really important piece about what we do. There's also over 550 prescription drugs included at no cost if it's prescribed at our clinic. These prescription drugs represent the most commonly utilized drugs on employer-sponsored health plans. These drugs are now at no cost to those patients if they get it at Nice Healthcare. There's over 35 of the most common primary care labs as well. So that's also an expense that those patients are not having to worry about. We'll do those draws in home. We also do in-home X-ray and EKG. Okay. If there's something that we can't do for the patient, we're going to help coordinate a referral for them through our care coordination team. It's our care coordination team is always available through our website and our app. Very speedy answers, right? If you need something, they're there to support you. You want to change pharmacies where you're picking up a prescription, send any medical records to a different clinic or to a daycare, things along those lines. There's also a provider chat feature where our providers follow up with patients, which our patients absolutely love because they get that additional touch point. But like I said, all this represents about 70% of everyday healthcare for a patient, where ultimately what we've done through these employers and our broker partners is break down the barriers to accessing care. These patients, typically through insurance, this well, Ben, deductibles keep going up, copays keep going up, right? That's one of the only ways to control those premiums, right? And what that leads us to is that patients have a lot of barriers to accessing care. It might be the cost thing, right? Like Thompson's example, our CEO, this $700 bill when he felt like he didn't really get any help, right? That's a huge barrier for families across America, right? They can't really deal with unexpected $500, $600, $700 bills. And so breaking down that barrier to where people don't have to worry about the cost but also see people, within a 24-hour window when they want that care is very, very fast compared to a brick and mortar setting through insurance.
So that was going to be one of my questions is how quickly people can be seen. So if someone engages in the app and they or engages via chat and it's determined that people need to the provider needs to come to them, that can happen within 24 hours.
Yeah, typically it's in a 24-hour window. A lot of times it's same day. And so, accessing care is different in every state, right? But Ben, I think the last time I was in town, we had looked, average time frame to get a primary care appointment in the state of Indiana right now, I think it was 47 days. Kind of accessing that care. So those are barriers for people too, right? Through a traditional system. Most people understand that they should be getting primary care and preventive care needs taken care of. They want to, but you add that cost component up with calling to get that appointment and you're told it's 47 days out. And then the day comes, you got to take a half day off of work. And then you sit in the waiting room all for a short appointment. It's just not super appealing to people, right? It creates a lot of, I call healthcare insecurities in the back of people's minds for why they might not access that care. But if you can break down those barriers, offer them this care in a way that, really mimics a lot of the conveniences that we see in our life in other areas. Probably a lot of people listening are utilizing Instacart, DoorDash, Uber Eats. These are things in which, people are willingly paying more for those services to have them come to us. But the nice healthcare model through employers is a way where these patients actually don't have any cost associated with it whatsoever, but they get those modern conveniences.
Yeah. Well, I think, someone, if they have to set up an appointment and go see a doctor, I even had an experience where I have a DPC doctor and I had a question about something. If I had to go in, probably wouldn't have asked, but I was a little bit concerned enough that I was like, you know what? I'm going to text the doctor and see what his thoughts were. And he was like, I think you should come in. And then I was like, okay, fine, I will. And same thing applies here. Of how many visits do you think exist where someone probably is a little curious, but there's such a barrier with scheduling and the wait time and all those sorts of things where they don't get seen. And that could bubble into something even more drastic.
Absolutely.
So I think creating that no cost option for an employee is huge. Couple questions. Does it matter if someone is on a copay or a high deductible health plan if they can have access to nice healthcare?
Yeah. So from a standpoint of those plan offerings, there's been a lot of changes in the recent legislation, right? So the laws currently surrounding virtual and remote care allow nice healthcare to offer these services at no cost. And so that's across copay plans as well as HSA plans, right? Those rules and regulations have kind of varied over time as well. So there's been time frames in which we've had a visit fee associated with those HSA plan members, but currently most of our employers and broker partners are pulling those out and doing care at no cost at nice healthcare.
Yeah, so that means regardless of what plan someone's on, those expense basically it's paid for by the employer, free to the employee for 70% of all healthcare services. That's incredible. When you talk about paying for employees, so you have let's say an employer has 50 employees and they have 30 of those employees that are on the health plan. What have you seen from employers? Do they typically pay for the 30 employees that are on the plan, or do they at times pay for all employees to have the benefit? What have you seen as a model has been developed in other states?
Yeah, most commonly, the most common practice you see is nice healthcare is added as a kind of a premium benefit that goes in conjunction with the enrollment on the employer-sponsored health plan. Where it's drawing those lines in terms of an employer's already taking on an expense of offering health insurance to those folks. it doesn't typically get extended into those kind of non-benefit eligible employees, but it does, depending on the employer group, right? Who might say, hey, like we really want to service our part-time population, et cetera. Yep. And so our clients really kind of work through that with our broker partners to kind of make an assessment of what fits their employer population or employee population, excuse me.
So if they pay for an employee to have access to nice healthcare, is it just that employee, or are there other family members in the home that are eligible to use the service? What does that look like?
Yep. It is the employee as well as their benefit eligible family members. And so, that's as defined by the employer, but typically you're talking about spouse, partners, as well as child dependents under 26. And so that's a fan favorite as well, of our employer partners, right? That we have that flexibility in that population to be able to extend to those benefit eligible family members.
How old does a child need to be seen by Nice Healthcare?
Yeah. We start seeing patients at 2 weeks for child well checks and things along those lines.
That's great. Yeah, it's been interesting as we've had conversations with employers already. Indiana is Indiana adopted clinics across the state where we're used to the idea of, hey, we want to have this other type of benefit that's actually a benefit where people can see a provider for more than 11 minutes and talk about their healthcare. And what's been fascinating to me is that as we've looked at Nice Healthcare in comparison with clinics, Nice Healthcare is actually half or a third of traditional clinic costs. And instead of employees needing to come to the employer's place of work, Nice Healthcare will go to them. And if you think about that, that's probably a better thing anyway, because if you're sick, you don't want your sick population driving into work. You want them to be at home getting well and that sort of thing. So that's really occurred to me that could be a really positive, clinic 2.0, if you will.
Yeah.
From what Indiana's experienced really over the last 2 decades.
No, for sure. I mean, it's even if you were to take away, the cost of real estate, healthcare real estate in any city for a near site opportunity, it's some of the most expensive for real estate out there, right? The strategy of moving into an on-site clinic model where an employer says, look, we've got a building already, we've got space already, we can make this work on site. It still, like you said, puts people in a situation where it's an arrangement typically that might be for only employees and not family members. Or if you're not feeling well, you got to go in and you got to say hey, why am I going here and everybody can see him at the clinic today, or whatever it might be, right? Not that it isn't great access to care, not that it's not great care. It's just one of those things that there's different ways to ultimately skin the cat and bring those benefits to people. And by taking out the real estate component, not asking an employer to get into the business of establishing an on-site clinic and having a 2-3 year contract with this kind of a specific vendor, they can get many of those benefits in the convenience of their patient's home.
Yeah. As we were evaluating this, as I mentioned, a year ago, there was a circumstance at our house where, we have three young kids, and one of them was sick. And so we had to take him out of school, and my wife had some of our, one of our other kids with her, and she's having to drag all of them to the doctor's office. And I was like, hey, what if you didn't have to do any of this and they just came to you? She was like, well, I don't know if that even exists, so I'm not even going to comment on how nice that would be. But I told her about Nice Healthcare. She's like, well, why don't you just bring that here to Indiana then? But here we are. Nice Healthcare are going to be launching in Indiana 1/1/26. And as you mentioned, and what we're really proud of is the deliverable of Nice Healthcare is through the broker channel and connection to health plans. And that's a preferred partner circumstance. So I'm really pleased to say that there are only 3 consulting firms in the state of Indiana currently that is able to help employers access nice healthcare. And obviously, one would be Connor Insurance, but also Benefit Innovations and Integrity Benefit Partners. Mm-hmm. So the three of us have collaborated to make this happen, to bring this to the Indianapolis market. And we're fairly confident that it's going to be land and expand. So not only are we looking at the Indianapolis market, again, the greater Indianapolis area, even up to like the Anderson, almost Muncie area, north to past Westfield, south to Greenwood, east over to Greenfield. There's a really, and then west to Brownsburg. So there's quite a service area that will be able to serve employers and their employees with on-site care at home, as well as at the employer business. But we know that as this grows, we're going to be able to expand that, not only expand the Indianapolis reach, which is already pretty big, but looking at those markets at, Fort Wayne, Bloomington, South Bend, Elkhart, Goshen, up into the region, and, the north central part of the state as well with Marion and Huntington and Kokomo. We believe that this is going to be a game changer for employers in their employee workforce, because the challenge that we see in healthcare is costs are going up, cost out of your paycheck is going up, and the deliverable that's left for employees is, I have a high deductible, it's super expensive, and it doesn't feel good. And the problem is, not only does it not feel good for the employee, it doesn't feel good for the employer because they're spending a lot of money. Yeah. And this is an employee benefit where we find that it is competitively priced because of the model, and employees can get 70% of their healthcare services for free. Just incredible. Jory, thanks for joining today. Again, we'll have to have you back to give an update on, where we're at with nice healthcare in Indiana, but also just to get your story, because we got to have some coffee up in Minnesota, and your journey is pretty epic as well.
Yeah, no, I appreciate it, Ben. Thank you for the partnership, and thanks to all of our other broker partners in Indiana as well. We don't get to where we're going with making healthcare more affordable and accessible without you. And we're super excited to get this thing launched and to start taking care of your clients.
Awesome. Well, thanks to our listeners for joining the first Solution Spotlight on the Risk and Resolve pod. Thanks for joining us, and have a great day.
Thanks. Have a great one.
Thanks for tuning in to Risk and Resolve. See you next time.